This is Damian Campbell from HGH Vallarta Clinic, and I'm honored to have with me today Dr. Adrian, why am I not pronounce this right? Eduardo Cuenca Bravo? Yeah, he's a pediatric endocrinologist.
Yes.
Thank you so much for coming today.
Thank you.
I guess the one question I have is, how long did it take you to get your pediatric endocrinologist, license?
Okay, it was like 3 years ago, right?
You got it 3 years ago?
Yes.
And how many years did you study to get that?
Okay, I studied 11 years to take my degree of endocrinologist pediatric. First, it was like 6 years, like a general doctor, I can say.
Uh-huh.
Then I studied pediatrician, 3 years more, and then endocrinology.
11 years studying.
11 years.
Well, it's great to have you on board. I mean, that's amazing. That's a long time.
Yeah.
So why did you decide to get into pediatric endocrinology?
The first thing I think I wanted, when I studied medicine, I wanted to do a pediatrician. It was my first reason. Then when I studied pediatrician, I liked the area of endocrinologist.
Uh-huh.
So it was important to me, like to help my family and to know about the illness of my family, the chronic disease of my family. Yes.
Well, that's a really noble reason to get into it. I mean, really, from my understanding, the earlier you can treat conditions, endocrine conditions,
Okay.
the better off you're going to be. I mean, so if a kid has a problem,
Yes.
the earlier you catch it, the better results you're going to get.
Okay.
Is that right?
Yes.
Yeah.
Yes. That's right.
Yeah, and so we've been working together. We've been specializing in growth hormone for kids. We work with a bunch of clients. I think right now we have about 30 or 40 kids we're working with.
Yeah.
And when a child comes in and sees you,
Okay.
and typically regarding growth hormone, typically,
To prescribe a growth hormone?
yeah, to prescribe growth
Okay.
hormone to a kid, or how do you evaluate that?
Okay, the first thing I have to see the percentiles of the weight and the height. The first thing I have to see how the weight and the height is about the CDC charts, that is the global chart.
Uh-huh.
So the first thing I have to see that, the weight and the height.
So you're looking for their height and their weight,
Yes.
and then you're looking at the CDC charts
Yes.
to see where they are to other children their age.
Yes, yes, and the global child.
For the global child's growth,
Yes.
children's growth.
Yes.
Uh-huh.
So the other important thing is to see how the kid goes about his familiar height target, because it is important. I have to get the familiar height target to see how many centimeters or inches is gonna be his final height of the final of the growth. Yes.
So you're talking about the family health growth target.
Yes.
How do you determine the
Yes.
family's growth
target.
height target?
Yes, it's a formula that we use, the pediatric endocrinologists, we use it. It depends, for example, in girls and boys it's different, because a girl, obviously, her familiar height target, it's below than a boy, because we expect that the boy has a better familiar height target. So I need the both parents' height to get my familiar height target. It's like an average, and then I get another formula to get this familiar height target.
Okay, so from your experience, typically when clients or when parents with children come and see you, why are they coming to see you? I mean, are they coming to see you because the kids aren't growing?
Yes, no, it's because they stop growing, or maybe his or her growth it is a little centimeters by I don't know, by the last 3 or 6 months. That's the reason they come with me. Or the other important thing is by the classroom they see the other kids, maybe they are the last of the line, of the kids line. So that's the reason.
Yeah, I mean, so what the conversations I've had, and I've had with you in the past is like, so if your child is not growing or hasn't grown for 6 months to a year, it's something to be concerned about.
Yes.
And at that point, I mean, if your child stops growing for a couple months, it's normal. 3, 4 months, 5 months, even 6 months, something can be normal. But when it gets extended, it needs to be. You need to take a look at, is there an issue or not, right?
Yes, it's because the growth depends on many factors. Because 1 month could be possible a kid growth 1 centimeter, the other month maybe not centimeters. It depends on many factors. For example, it could be possible for the season of the year. Some people say that, or the other important thing, like psychologist reason, for example, it could be
psychological reasons.
Right. For example, if we have trouble in this area, it could be possible that a child start to stop growing.
So if there, so one reason why kids might not be growing, they could have some type of psychological trauma.
Yes.
Whatever that may be.
Maybe nutrition, for example.
Nutrition also.
A low weight. Yes.
A lower weight.
Yes.
Yeah. So the kids need to eat, calm.
And obviously, and obviously there are many other, for example,
sleep good, right?
Yeah, the important thing, yes, it's the sleep, the hour of sleep, the hour to go to bed. It's important. And for example, to see there's not any chronic disease or any illness that is causing that a child stop.
How much should a kid be growing a year, say between the ages of 10 and 15 or 16? Like how many centimeters or how many inches should they be growing every year?
It depends. We have a chart of the growth velocity, so it depends of the age. Obviously, when we have a puberty signs, when we are in the puberty, we expect that a kid will have the maximum growth. So it depends. For example, like I told you, I have the growth chart, the velocity growth chart.
Right.
So the most important thing a child needs to be, or his or her growth velocity needs to be in the percentile 25.
Okay, so I mean, I don't know. You've been doing this for a while, so most kids are healthy, but sometimes when you deny growth hormone treatment, what is there a common reason? Or is it just kind of like, is it just all over the place as far as if a child comes in and he sees you, is there a typical condition that a child might have that would need to be treated before he would start using human growth hormone?
Like to see chronic disease or something like that?
Yeah, is there something like, I don't know, is there... Or typically or maybe another better way to phrase it. Typically when kids come and see you,
yes,
they're all healthy and they can use growth hormone.
Yes. I need to be sure. For example, the most important thing is not a patient with diabetes, because the growth hormone could be affected, or could get high the glucose. So
it can raise their blood sugar,
raise
their glucose. It can raise their glucose, yes. So diabetes would be a red flag.
Yes, it's not denied for patients. Be aware of this patient. Yes, to be, for example, they need to be in a control of the diabetes.
Right. So if a child has diabetes, growth hormone is still a possibility.
Yes. But
the child needs to be monitored more closely.
Yes.
To make sure their glucose is in check and everything's healthy and it's not producing any bad side effects.
That's correct.
Is that what you're saying?
Yes.
Yeah. In the first 6 months of treatment,
okay,
what's the minimum height expectation that a child should expect?
It depends, obviously, many factors too, because for example, we have a familiar height target. So many kids, they have his or her familiar target in the percentile 25 percentile, for example, and other one, they have the familiar height target in the percentile 90, for example. So I obviously a kid with the with a familiar height target bigger or taller, I expect they will grow more than the kids they have genetics like his or her familiar height target in the percentile 25 or 10. So that kids maybe will grow less from the other one.
Okay, so when you're talking about a child that has a growth that's in a 25 percentile, I'm confused there. So
Okay.
if they're in the, are you saying, I'm not sure, are you saying some kids that have, I mean, say, you have their family height target.
Yes.
And you're saying that a child that's, and so you have basically with the family height target,
Yes.
you can come up with the expected height of that child.
Yes, because for example, if a kid is in his familiar height target is in the percentile 25.
Okay, when you say that, that's where I don't understand. So
yes, it's because when
like, how do you know they're? What do you mean?
Yes,
they're in the 25 percentile.
yes, it's because when I get the familiar height target in the CBC growth chart, we have the growth chart. I put it, for example, in a boy, his familiar height target is 178.5 centimeters at the final of the growth.
Okay.
So it is this height. It's in the percentile, for example, 75. That means that this is the line in the percentile.
Okay.
75 is the line of the growth of a boy of a girl. So some boys and they have his familiar height target in the percentile 25. So that's the line.
Okay.
So it's
I see. Yeah. We know what we need. What we need. This would be much better if we had a chart. And
yes.
So basically, right. So you're saying when you do the expected growth of a child,
yes.
you're not saying this is the 100%. You're saying like usually you're more conservative. It's like if you say they're 174.5 centimeters, and you're saying, well, that they could grow taller than that.
Yes.
But I'm being conservative and I'm saying, listen, 174.5, which is like, it's not like the full potential, but it's a reasonable goal.
It's like
to
the
achieve.
average.
And right now, the child's at 25%.
Yeah.
And so the thing here is when you take the growth hormone,
yes.
the idea is to move you up to at least a 75 percentile.
Yes.
And by doing that, what the growth hormone is going to do is it's going to increase the velocity of growth. So you're going to move from the 25 percentile, which your child is at now, and then it's going to go up to 30, 40, 50. And then you're going to start crossing lines, and then you're going to get all the way up to the 75. And then there is a possibility that maybe you can grow taller.
Yes.
Is that more or less what you're saying?
Yes. It's for example. Yes, we have. We can expect the growth could be, or we have a child with could grow more centimeters when they are in his familiar height targets in the percentile. For example, 90 or 75. I'm saying that if I have a boy in the percentile 25, yes, with the growth hormone we expect he will grow in the percentile 50 or 75. But I'm not sure he will get the percentile 90 because genetically he has it's maybe not possible because his familiar height target, it's in the percentile 25. So maybe I could take 2 standard deviation, maybe in the percentile 50 or 75, but maybe I can get the percentile 90.
Okay.
That's that I try to say.
Yeah. Okay. Gotcha.
So a boy who has his familiar height target in the percentile 75 or 90, when he starts the treatment, obviously he will get more centimeters he will grow more centimeters per month than a boy that that it's his familiar target in the percentile 25, that yes, we start the treatment, he will start growing, but maybe the centimeters will be less than the other child. That's I try to say.
Okay, we'll continue this later. Yeah, Dr. Adrian Eduardo Cuenca Bravo.
Yes.
Yeah, this is the one I'd have trouble with pronouncing. Cuenca.
Cuenca.
Yeah. Well, thank you very much for being here. Really appreciate it.
Thank you.
Variety.